That's just the most recent example, though, of something the WHO put out there that drew some criticism. The main criticism, of course, you'll be familiar with, is that they overly relied on, that's how it's being characterized, on Chinese data and information. You were asked about that earlier this month, and you said there's, quote, no indication that the data that came out of China in terms of their infection rate and their death rate was falsified in any way. Do you stand by that statement, Minister?
Well, listen, as research evolves, what we're understanding in Canada, for example, is just and I draw your attention to the testing conversation we've been having over the last several months, that it is difficult to gather accurate data when you're in the middle of an outbreak. So, listen, I am always open to new information and new evidence. Even China has gone back to clarify the number of deaths that have occurred, and I can understand that as well, because as people are dying, if you're not able to actually test every person who has died during a pandemic, you may not have the full extent of what the death rate has actually been until after. So I think that there will be plenty of post-pandemic review opportunities, not just for China, but also for the World Health Organization and indeed for Canada. And I think all of those lessons learned are going to be incredibly important as we try to protect our citizens around the world from future outbreaks.
With respect, though, Minister, when you made that statement at the beginning of April, you said there's no indication that the data that came out of China in terms of their infection rate and their death rate was falsified in any way. It's true that Wuhan revised its numbers after you made that statement. But at the time, there were a number of questions about China's behavior throughout this pandemic. For example, presenting evidence that there was no human-to-human transmission, evidence which was then adopted by the WHO, and evidence that this country and you ended up relying on. You accused the reporter at the time, even, who asked you the question of feeding into conspiracy theories that many people have perpetuated on the internet. Do you stand by that?
Well, I think it's really important that we understand two things. First of all, one, that we were working with information that we had at the time, especially as in the early days. The World Health Organization has been a trusted organization for a very long time. Of course, it's not a perfect organization, which organization is. But I will also say that, I'm really proud of a civil service that continually comes back to me and says, evidence has changed. We need you to know that there is new information, that there's new science. We need to actually adjust our stance based on new information and evidence. And, our government has always said that we'll use public health evidence and the best science available to make our decisions. This is a new virus. It's a new experience for a world that hasn't seen a pandemic of this nature in 100 years. As I said, there will be a lot of review, and I am looking forward to it. I'm certainly looking forward to lessons learned for Canada. I think we'll all have an opportunity to do that. But right now, I stay focused on getting Canadians through this outbreak and through the next stages of dealing with COVID-19.
I understand, and I take your point, Minister. With respect, though, I guess I'm asking now, and I understand the point that you and the Prime Minister both have made, that this kind of reflection will occur after this is all over. But in the meantime, the reason I guess I ask these questions is because we continue to rely on information coming out of the WHO to inform the decisions that the governments in this country end up taking. And if the reliance on the WHO in turn depends on information coming out of China, are you confident that information is accurate and reliable? That's the statement that you made at the beginning of April when all these questions about China were coming out. You called it a conspiracy theory to even question the veracity of what was coming out of China. Do you regret those comments, or do you stand by them?
I think, to be clear, what I said was there were a number of conspiracy theories floating around, and there still are.
How can we trust the World Health Organization data?
So I would say that your question is feeding into the conspiracy theories that many people have been perpetuating on the internet. And it's important to remember that there is no way to beat a global pandemic if we're actually not willing to work together as a globe.
And I think it's really important that we understand that when we're dealing with an outbreak of this size, with a global pandemic, where in fact no country has been untouched, that we have to understand that the response needs to be global. So to your question, do we still rely on the World Health Organization? Well, yes, we're actually a partner country. We're part of an international research project called Solidarity that is looking at a number of the aspects of dealing with COVID-19, understanding more about the serology, as you pointed out, understanding more about the nature of this illness and how to treat it. All of those things have to be done in partnership with the international community. No country is immune, and so we'll continue that work, and we know that there will be questions asked of the WHO, of China, of Canada. And again, I think the only way through to understand this pandemic and to prevent future ones will be to be open to having those conversations.
Should there be an investigation into China's behavior during this?
Listen, that's not for me to say. What I will say is that we will
Why not,
continue.
Minister? Why not?
Because I don't have all of the evidence about what China did or didn't do. And I will say that, from Canada's perspective, now is the time, again, to continue that focus on Canada. Look, you said in your opening remarks, that there is evidence that the curve is flattening. This is good news for Canada. I'm staying focused on making sure that fewer Canadians get sick with this illness, that we have a strategy in place to deal with future outbreaks, and that we can move on with a health and social safety net that prevents future outbreaks of COVID-19.
Okay, Minister, I'll leave it there. I appreciate your time very much this evening.
Thank you very much.